This is poster 1105, the effect of Canagliflozin on ALT levels, data from the Association of British Clinical Diabetologists Nationwide Audit Programme, presented by myself, Tom Crabtree, and with special thanks to all ABCD audit contributors. These are my disclosures. The ABCD audit programmes were initially launched to assess new diabetes medications and technologies in the UK. The Canagliflozin audit launched in January 2016 and was the second SGLT2 inhibitor programme to launch in the UK. The aims of this audit was to collect anonymised routine clinical data for patients taking Canagliflozin in order to provide a real-world and perhaps more generalisable data set on its everyday use. Data input is primarily from free sources, either from primary or secondary care via the online audit tool, or from primary care separately, with large-scale anonymised datasets being submitted by certain clinical commissioning groups around the country. What we know so far about the effects of SGLT2 inhibitors on ALT levels is that generally the evidence supports that they reduce these levels. ALT has been demonstrated to correlate with liver inflammation, and although fairly specific for non-alcoholic fatty liver disease, it isn't particularly sensitive. That being said, it is still often used as a surrogate marker in clinical trials. There are some small-scale and large-scale real-world data sets that have demonstrated this as well as improvements in liver biochemistry. One trial has also demonstrated improvements in another measure, transient elastography or FibroScan, with the use of SGLT2 inhibitors. For this analysis, data were extracted from the ABCD audit tool, and those with baseline measurements and follow-up ALT measurements at 12 months, allowing a 6 to 18 month range, were included. Of a total of 730 patients identified, these were then stratified into groups using recognised gender-specific ALT reference ranges as follows. Data were analysed using status 16 and non-parametric methods due to skew of ALT. The baseline characteristics of our cohort are demonstrated here and are relatively consistent with a general diabetes population. Apart from differences in ALT between groups, the rest of the parameters are fairly similar across the 4 different stratified gender groups. Our results were as follows. Our analysis showed significant reductions in ALT across the population as a whole. However, when stratified by gender and then by raised or normal ALT levels, those with normal baseline ALT measurements did not have statistically significant changes in ALT at follow-up. That being said, those with elevated ALT levels at baseline had statistically significant decreases in ALT that were much greater than the total population. Regression analysis demonstrated further that elevated levels of ALT at baseline predicted larger levels of decreases in ALT at follow-up. However, due to multiplicity of measurements, no other baseline factors predicted ALT decreases with Canagliflozin in this cohort. Change in weight showed no correlation with change in ALT, which is perhaps the most interesting outcome of our analysis, as this might suggest a possible weight loss independent mechanism of ALT reduction with SGLT2 inhibitor use. This figure here demonstrates the reductions in ALT across each of the groups as well as the population as a whole. You can see that the population as a whole had a decrease of around -3 units per litre in ALT, with significant reductions in those with raised ALT levels at baseline and non-significant changes in those with normal ALT levels at baseline. In summary, Canagliflozin is associated with statistically significant reductions in ALT. These reductions are of a significantly greater magnitude in those with raised ALT levels at baseline, and, perhaps most interestingly, reductions in ALT appear to be independent of weight loss. However, there are some limitations of our analysis. Due to the observational data set and the nature of it, we're unable to correct for some confounders such as alcohol use. Further work might include a more detailed analysis using a validated NAFLD scoring system such as the FIB4 score to assess the impact of SGLT2 inhibitors on multiple parameters. Thank you for taking the time to listen to this presentation, and the references used in creating these slides are listed on the final slide.